Hey nerds. Today we're going to talk about the medication Prozac. And if you know about Prozac, you have a very good understanding of the other SSRIs, which are in the same class. They are unique though. And Prozac is a good one to start with because it's sort of the most well-known, and it's also the friendliest one. It's also kind of has the least negative side effects. And it's also more on the stimulating side. Some of the SSRIs are more sedating. So it's available in a 10 milligram, a 20 milligram, or a 40 milligram oral tablet. There is a dermal gel where you can kind of rub it on, but that's not available to the public. That is only used for research purposes or also for animals. That's used for veterinary medicine. So we only have the oral pill of Prozac. And it's usually used if someone has a low mood, a depressed mood, or they have a lot of worry or anxiety and concern. Specifically, things like OCD, where you have obsessive compulsive feelings, as well as very PMDD, which is very, very bad premenstrual syndromes, to the point where you feel like you can't function properly. So, eating disorders also are helped by Prozac, and it's available, like I said, in different doses depending on how much you need. However, once you start that dose, it doesn't kick in right away. It's the type of medication that needs to build up in your bloodstream. So, you should see effects if you're starting it in about 4 weeks or so. Sometimes longer depending on the individual, but you'll know like the kind of the full effects of it. Again, it's very stimulating. So it's kind of more of a wakeful med. So you wouldn't want to take it ever at night. There are a lot of people who shouldn't take it at all. For example, the elderly, it can cause more issues. If you have a lot of falls, especially, it's kind of like it makes it worse. So you want to kind of avoid it if that's the case. And otherwise, basically, just people who have a low sodium, naturally, this can make your sodium even lower. So you want to be really careful with that. Nausea and diarrhea can also occur, as well as sort of like a motor tremor or restlessness. It can also cause cardiac issues. So definitely make sure that Prozac is for you or this is what you need. How does it work? Really, what it does is it makes in your brain more available serotonin. So the happy chemicals, right? It prevents them from being kind of metabolized. So it leaves them in your brain where we can use it. So that's how it works. The other thing too is coming off of it. It's one of the medications, as many of the SSRIs, that you want to kind of taper off of and you want to come off of very carefully. There's kind of like a very emotional, turbulent period that people go through, and it's pretty widely publicized because unfortunately, it can cause a large amount of feel emotions, dangerous emotions, and unfortunately, a lot of crimes occur when people are coming off of the antidepressants, right? Does that mean that it is a not for you or a bad thing? Not necessarily. It has to be really weighted against, using the drug and coming off the drug. Just doing it carefully, everything will be fine. Some people have no major issues coming off of it. And if you kind of want to try an SSRI and you don't want to stay on it necessarily, this might be the one for you because it has the lowest risk of the discontinuation syndrome that I'm speaking of, where you have these like high levels of emotional turmoil feelings, and people sometimes act on them, right? It's widely known that when you start the antidepressants, your risk of harming yourself increases sometimes because you now suddenly have energy you didn't before. There's also a concept for those actively on the medication called Prozac poop out, or this can apply to any SSRI. This means that it's like It works sometimes, but sometimes it doesn't work. We're not talking about actually pooping out like the medication, but we're talking about the concept of it doesn't consistently work. For whatever reason, sometimes it the happy chemicals are not there for you. So ways to decrease this feeling of it not working or Prozac poop out is to avoid actually smoking and drinking because that actually has the opposite effect and it kind of makes it not work for you as well. So that would be a problem. So it's very important that you implement the lifestyle changes as well, even if you do end up needing the medication because it's not going to work as well and you're going to have excessive side effects and not as good of an outcome if you don't implement the lifestyle changes with the medication and maintain that. There's also some sexual side effects, as with all of the SSRIs. It can affect that area of your life. Um, you might not be interested as much as you were, or something along those lines. There's alternatives if that bothers you. Um, but it does cause sort of sexual side effects. Very interestingly, Prozac and the SSRIs sometimes help with things like rashes, eczema, sort of like psychosomatic symptoms, um, dermatological symptoms, or arthritic conditions, rheumatological issues. Sometimes a SSRI will kind of help you to not experience these conditions quite as bad.